Cap top area access and diagnostic procedure. Please note, this procedure is only for checking the cap top seal under the printhead. Please do not use it to load inks into the printhead unless you have opened the valves behind the cartridges. Otherwise, ink will not flow into the head. Follow these easy instructions.
Step 1. Remove the cover. Carefully remove the printer cover to access the area beneath the capping station. Step 2. Locate and release the tubes. Identify the 2 tubes running under the cap top and gently release them from the clamps holding them in place. Step 3. Disconnect the black connectors. Open the black quick connectors attached to the tubes. Important: do not lose the sealing rings located inside the connectors. Set them aside safely for reassembly.
Step 4. Connect the diagnostic tool.
Use the diagnostic tool. Connect both tubes to the ones coming from under the cap top. Make sure to reinstall the sealing O-rings before reconnecting. Option B. If the tool is unavailable, use a standard syringe. Connect it to one of the 2 tubes. Seal the other tube completely to prevent air from entering. Step 5. Perform the seal test. Slowly pull back the syringe plunger by just a few millimeters. If you feel resistance and the plunger pushes back slightly, the cap top is sealing correctly under the printhead. If the plunger moves easily without resistance, air is likely entering the system. The cap top may be worn or misaligned and may need replacing. Step 6. Reassemble the system. Disconnect the syringe or diagnostic tool. Reconnect both tubes using the black connectors and replace the sealing O-rings. Secure the tubes back into their clamps. Close and reattach the printer cover securely.
Like and subscribe for more helpful printer tips.